Welcome to NCPDP, Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators, discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
Rick, here we are. We work together all the time.
Yes, we do, Whitney.
And here we're going to do a formal interview.
I'm looking forward to it.
Me too. It feels a little odd, but I'm looking forward to it. And I even had to bring notes.
Oh,
because
great.
as it turns out, we're talking about some alphabet soup today. And I couldn't keep all the acronyms in the right order.
Yeah, I'll try not to talk too much in acronyms today, but it's hard not to when you talk about something that has to do with the government.
Oh, that's true. So, okay, so I'm going to read this out. So we have MTF, which was established by CMS
There you go.
to support DPNP, but subject to an MFP as determined under the IRA.
There we go.
Is that right?
Yes,
But
yeah.
I missed
So now
X,
let me
Y,
see if I
Z.
can catch all those, huh?
Hold on, I missed X, Y, and Z.
Yeah.
Like, where do
well,
those
that's
letters
probably
fit
the
in?
next question, right?
Yeah.
Again, the government, anytime they have an initiative, it has to have an acronym. And I think they spend a lot of time just coming up with those. But the MTF, which is the Medicare Transaction Facilitator, which is basically a facilitator that manages the transaction between the pharmacy and the pharma manufacturer. And that rolls under the Medicare Drug Negotiation Program, which is part of the Inflation Reduction Act, the IRA, for maximum fair price, which is the MFP. So I think I defined all the acronyms, but I'll try to steer away from those as much as I can. But because it does get confusing between MFP and MTF, especially in these. But essentially, it's a program that was established under the Inflation Reduction Act that established a maximum fair price or a maximum price for a certain number of drugs, and then we've established 10 drugs for January 1st of 2026 that would be the maximum price that a patient would pay for that particular drug. It may be less if they hit their maximum out of pocket, but it would be no more than that.
And that's max for Medicare. That's
for Medicare Part D. Thank you. Yes. So this is only Medicare Part D as in dog. And those are the commercial prescription plan. The Medicare Part B, which is the medical side of that, will go into place in 2028, I believe, January of 2028. So they're slowly putting more drugs and more programs into this. So there'll be 10 drugs in January of 2026, another 15 in 2027, 15 in 2028, and then they go to 20 a year thereafter. So when you first look at it, say it's 10 drugs. How how complicated can it be to adjudicate or price 10 drugs? But eventually there'll be hundreds of drugs that'll be on this program, and so we spent a lot of time making sure that we have a process to make sure that we can adjudicate the transactions or determine the price of the transactions, and then properly reimburse the pharmacies for this. And the big issue with the whole IRA program, or this whole negotiated program, is that the prices that they've negotiated are, in most cases, lower than the price that the pharmacies pay for those drugs. So if there's a $100 drug to a patient, in many cases that pharmacy is paying significantly more than that price of that drug. And so there needs to be a mechanism to reimburse the pharmacy for the difference between what they're paying for the drug and what they're selling that drug for. And that's what this whole process is about. And the Medicare Transaction Facilitator has been stood up by CMS to allow for the facilitation of that extra payment that needs to happen to the pharmacy.
Right. Okay. So the first 10 go into effect January of 26, correct?
Right, that's correct.
And so what do pharmacies need to do to get enrolled?
So yeah, that is key. They need to enroll in the MTF, in the Medicare Transaction Facilitator, because in order for that supplemental payment to be made, the Medicare Transaction Facilitator needs to know where to make the payment, and then also how to help the pharmacies reconcile that secondary payment. A lot of pharmacies will use a third-party vendor that will accept payments for them in some cases and reconcile the claims, which are usually can be two separate vendors in addition to that. So the MTF needs to know where to make the payments and where to make the reconciliation reports available. And in fact, when they're making payments, whether they're making them directly to the pharmacy chain headquarter or a third-party vendor that's working for that pharmacy, there's a process that the pharmacies have to go through to set that up. And that's the key part right now is if a pharmacy is not set up for that, they have no mechanism to pay them for that secondary portion of the payment. So they've been doing a lot of communication. We at NCPDP have been doing a lot of communication on that, and other associations in the pharmacy industry are doing that as well. But I heard a report as early as yesterday, I think it was, that said 62% of pharmacies still don't understand the details around this program that's coming into play, which is worrisome.
That is concerning.
So, we need to continue to get the word out.
So when you say the details, do you mean how the program works or how the enrollment process works?
Well, it's probably, always defined in how they did the survey, but I think it generally is they don't understand all the details behind or the importance of enrolling in the Medicare Transaction Facilitator.
Can you share that here today?
Yeah.
What is that importance?
In order for them to receive that secondary payment, they need to be signed up, and there's a process that they go through. So they can sign up as a representative of a chain. So if they have 100 stores or 1,000 stores or whatever, they can have a representative set that up. The important part of enrolling in the MTF is making sure that the person who has legal authority on that particular pharmacy is the one that initially sets the account up with CMS, with the MTF. And there's a process that the government goes through to do identity proofing to make sure that person that's coming in is the authorized official for that particular pharmacy, because they are putting in banking information and a lot of sensitive information about that particular pharmacy. And they're using the NCPDP pharmacy data file as their source file, the MTF is, to ensure that they can do a match between the owners or the legal authorized official in the pharmacy and the person that's actually enrolling in that. So they need to make sure their information is up to date and accurate in their NCPDP file, which we make available to all the pharmacies to be able to update that information. And one of the key elements that we always reinforce to the pharmacies is this: the authorized official needs to have their legal name in their NCPDP file record. In order to do the identification proofing, the legal name is key there. So if I have Rick Sage in my authorized user, but my legal name is Richard Sage, it won't pass.
I see.
And so we're having a lot of the pharmacies go in and make sure they have the right address, the authorized official name is correct, they have their third-party vendor set up correctly, as if they are using a reconciliation vendor or someone that's going to do a payment center services for them as well, before they start their enrollment process.
Yeah.
Going through that, there's several steps that they have to go through, and once they do get that account set up, then they can authorize other people that can get into the account and be able to manage that account for them.
So let's kind of recap that. So the process is to update their NCPDP profile, and that is what's going to be used to ensure that these payments can get made to those that have enrolled. Is that correct?
Yeah, essentially the pharmacies have the ability to either enter all of their information manually in the MTF enrollment system,
Okay.
or they can do a select and fill option, which is essentially saying, take my information that's in the NCPDP pharmacy file and populate all the information into the Medicare Transaction Facilitator system. And the benefit to that is, one, they don't have to enter all that information a second time,
absolutely.
right? And the other part is, if any of that information changes, They're already used to and knowledgeable about updating the NCPDP file, and that information will automatically then update into the MTF records then as well. If they select to do it manually, which they can do that manually, but that means if there's any information that ever changes going forward, they'll have to not only go into the NCPDP file because all the other third-party payers are using that file today,
Right.
they'll also have to go to the MTF and update that information as well. So they wanted to, they set the MTF set that process up so it wouldn't force people to do it, but we're greatly encouraging people to make that process as streamlined as possible.
It's also a great opportunity to point out that NCPDP has a whole team of database experts who are just ready to help pharmacies update their profiles and answer their questions, and so we're always here and ready to answer.
Yes, definitely. We've definitely seen a spike this year since this, and about once a month CMS holds a information session for the pharmacies and reinforces this same message that we're talking about today. And our spike of our updates go crazy right after that, which they just had a session last week. So even though the government is shut down right now, the group that's working on this with CMS is considered an essential workers, and so they're doing updates and doing testing and working with our pharmacies and holding these webinars and stuff. So it's business as usual for them, even through this process, to make sure that everybody's ready for January 1st.
Yeah, absolutely. So it sounds like a complex process, but is it?
You know, it's complex when you talk step by step on how it is all coming together, but between the work that needs to be done by the pharmacy management systems, the work that's being done by the Medicare Part D processors, and the work that's being done by the manufacturer, the Medicare Transaction Processor, and then the actual pharma manufacturers as well. So there's a piece for everybody. Once all of that is in place, it should be seamless. A patient comes into a pharmacy like they would for any other prescription and fills that. If it's a Medicare Part D, the pharmacy is going to send that transaction to the Medicare Part D processor. They're going to look and say, yes, that's a Part D patient, and if that is one of the 10 drugs that's on the formulary for the MFP pricing, it will then price the drug at that maximum fair price that's been negotiated. It will then send a paid claim back to the pharmacy that says this patient is eligible and the drug falls into the IRA program, and here's the amount to collect from the patient. And that's the normal process for any Medicare Part D drug. But in addition to that, for those drugs, it'll put an indicator on the response coming back saying that this is an MFP drug, and there will be a second payment coming back to that pharmacy. And so the pharmacy will need to set up a second receivable because they'll actually get two different payments, one for the drug that's been dispensed at the pharmacy through the Medicare Part D processor like they always do, and then they'll get a second supplemental payment to make them whole from their cost of the purchase and that MFP price.
Okay, so wrapping up, is there any other advice that you would give to pharmacists to make sure that they're completely prepared before the January implementation date takes effect?
Yeah, the biggest thing and the biggest confusion that's out there is there are pharmacies out there that either feel that they don't fill any of those 10 drugs today, or they haven't decided yet whether they're going to fill those drugs moving forward. And so they're hesitating enrolling in the MTF process that we've been talking about today. My advice and CMS's advice as well is to go ahead and enroll in the process. Whether or not you feel you're going to fill any of those 10 drugs, remember there's going to be 10 more next year, or 15 more next year, and then 15 and 20. And so there is no tie, no commitment if you sign up and register with the Medicare Transaction Facilitator that you have to accept those prescriptions that are coming through. But if you do fill one of those prescriptions, you're not going to get that supplemental payment unless you're enrolled in the program. So the advice that I would have for all pharmacies is to please go in and enroll your pharmacy in the MTF, and that is basically an insurance plan in case or when you fill a prescription that falls under this program, that you'll have that reimbursement coming back.
That's great. Thank you so much for going through all of this. I think it's really going to help people understand a little bit better.
I hope so.
I hope so
It
too.
can be confusing, but when you bring it down to the basic level of what they need to do, and then they can keep doing business as they do already. I think that's the key.
And it sounds like it's going to really help financially as well to fill in that gap.
Yes.
Yes, absolutely. I always like to close my episodes with a little fun question.
Okay.
So I'm putting you on the spot.
Yes,
I
you
know
are.
this. So tell me, what's the most exciting thing that you've done this year?
Oh, this year.
This
Okay.
year.
I would say it was a trip to Greece, Turkey, and Egypt.
That's exciting.
Yes, and it's a place I've not been, and definitely enjoyed myself there, and love to visit that area of the world again.
Great. Thank you again.
Thank you, Whitney.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.